Nearly 1/3 of adults worldwide are now dealing with fatty liver disease. And right now, there are 0 FDA-approved medications specifically for treating it. The problem is, you can't afford to just wait and see while your health declines. So, how can you put together a plan that actually works to reverse fatty liver? In this video, I'm breaking down the top 3 science-backed supplements that stop your liver from accumulating fat and finally start to heal. And I'll introduce you to some functional foods that help as well. I'm Dr. Kate, and I've spent over 15 years helping people get to the root cause of their health issues using functional medicine. I've seen firsthand how fatty liver is on the rise, and the most frustrating part is that people are being told there's nothing they can do to stop it when the science says otherwise. So let's stop waiting. In this video, we're going to look at why your liver is struggling in the first place, and then dive into the 3 specific supplements the research shows can actually turn things around. Non-alcoholic fatty liver disease, or NAFLD, is a massive problem. It affects nearly 1/3 of the adult population worldwide. Essentially, it happens when your liver cells start accumulating fat. And I'm not talking about liver damage from alcohol or viruses. I'm talking about fat buildup due to metabolic imbalances. The scary part about NAFLD is that early on, you might not have any symptoms at all, or they're so subtle, you ignore them. Maybe you feel a bit more fatigued than usual. Maybe you feel weak or have unexplained itching. Sometimes your body gives you physical clues. Look for darkened skin patches over your neck, elbows, or knees. Look for tiny spider-like blood vessels on your skin. Or the most common sign, fat accumulation around your midsection. Usually, people only find out something's wrong when a doctor sees elevated liver enzymes on a blood test or spots fatty deposits on an ultrasound. But by then, NAFLD has usually been happening for quite a while. If it progresses into what we call NASH, non-alcoholic steatohepatitis, that inflammation can lead to permanent scarring or cirrhosis. We want to stop it long before it gets to that point. So what actually causes this? It's rarely just about the fat you eat. It's about blood sugar. We're talking about metabolic syndrome, prediabetes, and type 2 diabetes. When you have high triglycerides and abdominal obesity, it creates a perfect storm for the liver. But the primary dietary factor that I see in my clients is excess processed carbohydrates and sugars. Fructose is the biggest offender. Unlike other sugars, fructose goes directly to your liver to be processed. There, it acts like a switch that turns on fat production. This is why high fructose corn syrup in sodas and processed foods is so damaging. There's also a gut-liver connection. If your intestinal bacteria are imbalanced, what we call dysbiosis, your gut barrier can become leaky. This allows toxins to circulate in your blood and hit your liver directly, causing even more inflammation. This brings us to our first science-backed supplement. This is a gut-liver superstar called Akkermansia muciniphila. Recent research, including a major 2025 study, shows that Akkermansia is a game changer for hepatic liver metabolism. In these studies, Akkermansia supplementation resulted in lower body weight, a lower fat percentage, and a significant decrease in triglycerides. They also found that Akkermansia treatment significantly modulated gut fungal diversity, enhanced gut immune responses, and of course, improved fatty liver. This VIP helpful bacteria works by improving insulin sensitivity, regulating lipid production in the liver, and protecting your gut barrier. When your gut barrier is strong, fewer toxins reach the liver. It also increases something called cholic acid, which protects against fat deposition. In case you're curious, I've put the specific brand and dosage of my preferred Akkermansia supplement in my free fatty liver checklist for you. You can grab that at the link in the description, so you don't have to worry about taking notes. One vital thing you need to know about taking Akkermansia is the Herxheimer reaction. When you start regenerating the good bacteria in your gut, they start to crowd out the bad guys. When those bad bacteria die off, they release toxins called LPS into your system. This can cause a temporary reaction, things like mild heartburn, bloating, gas, or even a bit of diarrhea for a few days. Don't let this scare you off. It's actually a sign the powerhouse postbiotic is working. If it happens, you can usually push through it, and it should clear up within a week or two. Next, we have NAC, or N-acetylcysteine. I use NAC because it's a precursor to glutathione. Glutathione is your body's master antioxidant, and it is essential for liver detoxification. NAC protects the liver from environmental toxins and heavy metals. Research shows that NAC can actually block fat accumulation in the liver. It does this by regulating specific scavenger molecules that manage how your liver handles fat. It's also incredibly anti-inflammatory, reducing markers like IL-6 and TNF-alpha. In simple terms, it helps calm the fire in your liver so it can start to repair itself. The third supplement is one you've likely heard of, milk thistle. But we aren't just looking for any milk thistle. We're looking for the concentrated, active compound called Silymarin. Silymarin is a powerful antioxidant that optimizes mitochondrial function in the liver. It doesn't just help prevent damage, it may actually help prevent the fibrosis or scarring of liver tissue. In a 12-month study of patients with NASH, a protocol of Silymarin combined with vitamin E and phosphatidylcholine resulted in the normalization of liver enzymes and a significant decrease in liver fat seen on ultrasounds. This isn't just theory, this is clinical evidence that your liver can improve. Before we wrap up, remember that supplements work best when they have a solid foundation. I always recommend a Mediterranean-style diet, but with a liver-friendly twist. Focus on polyphenols. These are plant compounds often found in leafy green vegetables that protect against cellular stress. Pomegranate is another great source of polyphenols. And don't forget your sulfur-rich cruciferous vegetables like broccoli, cauliflower, kale, garlic, and onions. These provide the sulfur your liver needs for its phase 2 detoxification pathways. Also, make sure you're getting enough choline. Choline is essential for transporting fat out of the liver. You can find it in egg yolks, animal protein, and chickpeas. If you're ready to stop the wait-and-see approach and actually give your liver the tools it needs to heal, I want to make this as easy as possible for you. Go ahead and download my free fatty liver checklist. It includes the 3 supplements we talked about today, plus my top dietary tips and the links to the exact professional-grade versions that I use with my clients through my full-script dispensary. And if you've never ordered through my dispensary before, you're in for a nice surprise. The link is right below this video in the description. Grab that checklist to take control of your metabolic health and restore your liver health. Thanks so much for watching, and I'll see you in the next video.